Hi everyone, welcome back to the podcast. This is Talk to RK, amazing podcast. I'm very excited to always have this connection between us. We're always in a relationship, you and I, and it's Talk to RK. This is a safe space for everyone to talk and express how they feel comfortably. This is not like the normal podcast where we have like a specific topic to talk about. This is just an expressional podcast, and I believe it's going to be inspirational. My guest today is someone very amazing. This is a very amazing personality. It's so funny how we met. I met her at Tram Shed here in Cardiff. Was having a stick outside, and it was just so amazing because I wasn't eavesdropping, but I was having a bad time, a little bit depressed, and I had a conversation. She was talking to her friend about her life and her situation at the moment. Right now, she's going through a process. She's going through chemotherapy and all of that because she has cancer. And according to her doctors have said to her she has about 6 months more to live. And when I heard her speak, she was very, very comfortable talking about it. And she was really happy to live her life, and kept coming out for a show. Was like, okay, this is someone that knows that I'm not going to be here for a very long time, and I'm not moping about it. I'm here and I'm going to have a good time and express myself in the best way that I have. Ladies and gentlemen, my guest tonight, Jolene. How you doing?
I'm fine, thank you. A little bit tired, but I'm fine.
I know. How have you been? What's been happening?
Oh, well, since I met you at the Tram Shed, I deteriorated quite quickly, and I had to have emergency radiotherapy treatment, which brings that total to 45 rounds now of radiotherapy that I've had, because I was struggling to breathe, to swallow, and sometimes even to talk. So we had an emergency CT scan, which showed all the tumours inside my chest have grown and all across the lymph nodes, which was then causing swelling around the major vessels and all in my neck. So that's why I had to go in and have emergency radiotherapy. So I've been quite poorly, however, doesn't keep me down, doesn't keep me in bed. I still drag myself up every morning. And it's my children that do that. They're finding it tough, and I think they'd find it even tougher if they just seen them wilting away in bed. We had an amazing Christmas, spoiled them rotten, as well as spoiling my husband. But it wasn't about me, Christmas. Christmas was about my husband and my children. Yeah. And I was happy just to see them happy. And that's what gets me up every day. Is my children and husband.
Talking about happiness, what drives me about you is the fact that you're happy, and how much you're happy knowing where you're at. And it's different for so many different people. People cannot handle this kind of situation.
Yeah, and the reality of it, a lot of people struggle with the reality of the fact, they have cancer, it may be terminal. And, each person deals with that differently, and there's no right or wrong way of dealing with it. But just for me, it's about making the most of the time that you've got left and not dwelling on the cancer. So it's not allowing cancer to beat you. So, inevitably it's going to, because I know I'm dying, but that then shouldn't put a dampener on every single day that you get up, because every day's a new day. And I can feel really low and poorly. And then some days I have really good days, and then I take advantage of that. Yeah. So when I feel really good, you're not going to hold me down. I'll go and do all sorts. My oncologist constantly is having a go at me because I overdo it. Yeah. And then I crash and burn because I've got no energy then to get out of bed. But life's for living, and I just believe you've got to live it. You got to grab it, haven't you, by two hands, because life is so precious. Yeah. And I always say, tell those you love how much you love them. Hold those people, when you're giving somebody a cuddle, just hold it that little bit longer. But I think it's important, and I'm happy knowing that I've done the best that I can for my friends, my family, my children, my husband. And yeah, that makes me happy because I'm not afraid of dying. It's not the dying I'm afraid of. It's the leaving them behind and how they're going to manage. So, and putting things all in place for when that does happen. You know, making sure that my husband knows how to use the washing machine, you know, knows how to cook basics, because I've very much done it all, if you like, and leaving almost like an instruction manual of what to do, where to go, where you even get your son's, your children's clothing from. I've written lists upon list upon list.
I know. It's really hard to understand the switch. You know, have you always been this happy? Have you always, before you got diagnosed, is there any change? Is there any difference from how you lived your life before and now?
Yeah, I'd say before, for myself, it's not been easy. I'm 47, just turned 47. And they've not been an easy 47 years. You know, both of my parents passed away suddenly.
Wow.
My father went out for a jog and never come home again.
Wow.
And he was 60, and my mum had a blood clot that travelled up her leg and went straight to her heart 18 months after. And I was the one that gave my mum CPR because my mum was with me, but it was too late. So it's not been easy. My life's not been simple. Far from it, far from easy. But I've always been a happy-go-lucky, bubbly, person. What has changed is recognising how precious life is. When I lost my mum and my dad, that taught me a huge lesson, is never put off something. If you want to do it, do it.
Yeah.
Because tomorrow may never come.
Yeah.
So I live for now and not a week, 2 weeks, 3 weeks, 4 weeks down the line. I live day by day because I could quite easily go to bed tonight and not wake up in the morning.
Do you think that's how everyone is supposed to live day by day? Because there's a difference now, because you know your fate and you know what's going to happen. That's why it's almost like you're embracing every moment and catching every memories you can receive. And there's so many people in life that do not appreciate these things. Don't get me wrong. People can, be healthy and the next morning they wake up and they run into an accident or something.
Yeah.
Is there some sort of secrets to life now that you know what's going to happen and then you just want to enjoy every bit of it? What's the secrets to how you're living right now?
I don't think there's any secret to it. I just think it's down to each individual and how that person takes on news, such as when I found out, that I had cancer.
How long ago was this?
So I knew I had cancer. Back in February 2022, I became very poorly and I was sent off work. And I pretty much knew from February onwards that I had cancer. And I was back and forth to the doctors, back and forth to the hospital, but nobody would listen to me. And because I have other underlying health conditions, they displayed symptoms in a very similar way to lung cancer. I think that's how it went overlooked. And it wasn't until I went back again in the October, took myself into the medical emergency admittance unit, and told them that I wasn't leaving until they told me what I inevitably knew. So it took them the best part of 7 months to listen to me. And then when they discovered the cancer, it was already at stage 3B, inoperable, and only a 5% chance of cure. So I was very angry.
Yeah, because I'm trying to understand this, because they had the chance to discover what was going on early. This is life anyway. What's going to happen is going to happen. But I'm thinking, what if they found out earlier? It would have been much different now.
I agree. If somebody had actually listened to me, when you go back and forth to the hospitals and, third, fourth attempt, and they're telling you it's your diabetes and your fibromyalgia, after 4 attempts of trying to treat that, and it makes no difference, and extreme weight losses, extreme, being so lethargic that you literally could fall asleep standing up. And I actually did, as I was decorating a ceiling with an extendable painting rod. I actually fell asleep while painting. It was all over my carpet, all over the TV.
Wow.
And my head was actually asleep on the end of the roller, and my husband and son had to put me into bed. Thank God it was only emulsion, because it'll come off your TV.
I know.
But when you're that tired, that is something more. And I've been a diabetic for years, and I knew the difference, and I knew something wasn't right. Well, I knew it was cancer. But what didn't help was that then when they did the blood testing for the cancer markers and the x-rays and the MRI scans, it didn't show anything at all. It was only the fact that this one particular consultant in the hospital pushed to have a CT done. And he battled, because initially they didn't want to do it because it was too expensive. And I overheard that conversation. The consultant pushed it. And then literally within 2 days, I had the diagnosis that they'd found what they believed to be cancer. I then had to go and have an emergency endoscopy, where they then discovered, the type of cancer that it was. But in addition to that, I also had several blood clots below my lung, which is frightening, because that's how my mum died, was of blood clots. And how long had I been walking around with these, because they could have killed me at any time.
Right.
So, yeah, it's...
That should have been really heartbreaking, hard to take, because no one listened to you. And this is almost like a message to the hospitals and the medical practitioners and everyone.
They need to listen.
Exactly.
They need to listen a little bit more to their patients, because I think you know your own body, and that would be my message to anybody. If you feel different, if you know that there's something not quite right, don't just take a person's one opinion, like a doctor's opinion, that everything's all right. Because I'm a prime example that everything was not all right. And it was only through me pushing and pushing and pushing that I actually got the diagnosis myself.
Wow, that's heartbreaking, In terms of your family, right? I know that's like a very important part of your life, because from what you explained, you spoiled them from Christmas. I mean, you always want to be around them right now. I'll share my story. My mom died of CKD, chronic kidney disease, and 2017 to 2018 was the darkest period of my life. You know what I mean? Because I saw her suffer.
Yeah.
Back home in Nigeria, it's not like here in the UK where you get free medical services and all of that. So we had to pay for all the dialysis and all of that. So
I'm sorry.
Yeah, watching my mom go was horrible. Now, just like you're more bothered about how your family would handle stuff when you're gone.
Yeah. And I'm more, we've had the discussion. I've always been very open with my children. My 2 children are aged 14, and one will be 16 in April.
Bless them.
And I've always been very, very open and honest with them from day one. So they know that I'm dying. My youngest son has been in, and the nurses were fantastic and showed me being prepared for radiotherapy, and then stood outside with them, obviously, and watched the whole process. I think that gave them a bit of reassurance that Mum wasn't being hurt. And then my eldest came in on the end of my chemotherapy treatment, because I think it's just they want that little bit of reassurance as well, that where's Mum going? What's the treatment all about? Are they hurting her? And I do worry about me kind of wasting away in front of them. That does bother me, but we've talked about end of life, and whether they prefer me to be at home or whether they prefer me to be, in a hospice. We've all decided to stay, that I want to be at home, but it has to be about my children, and how they will cope with having to go back into that house once I've passed away. And I've said if they, were to change their mind and felt they couldn't cope seeing Mum poorly, then I would happily go into hospice. because it has to be about my children.
Yeah.
You know, they're the ones that have to deal with their grief and the bereavement once I've gone. So it has to be primarily about them. Obviously, my husband as well.
Yeah, I was
But
going
my
to ask.
husband's an adult, you know, and these are children are going to be really needed support on a huge level, you know. But I do worry about my husband. It's heartbreaking.
Yeah.
Heartbreaking
Yeah, I know. I
to
know.
see a husband cry. You know, it's not nice. Knowing you're the cause of that, but not being able to do anything about it at the same time. But I have my moments in the shower when people can't hear me and when the shower's running. That's when I have my time, because I don't want my husband or children seeing me break down.
Yeah. That's very thoughtful, and it's important to know that your family are there right now and they're trying to, be there and make these memories for you. Because I'm gonna ask again, and it's about being grateful. You know what I mean? Do you feel there's some sort of like you've lived 47 years of your age and of your life, and all the 47 years that you've lived, do you think people should be more grateful when they're alive and seeing life?
Yes, I do. Life is so precious. And I've had, you know, life taken away from me in respect of my mum and my dad. I lost a little boy stillborn. And it's very difficult for somebody to appreciate their life, I think, when it's kind of goes along quite swimmingly for them, because there's some people, unfortunately, that are not born under a, they seem to be born under a grey cloud then. And it always seems, it's not just raining, it's pouring. Whereas other people can kind of go through life and not experience anything like that as such. But I don't think it's until you yourself are poorly or a family member that dies suddenly, I don't think people just appreciate how precious life is.
Yeah.
I really don't think people do until they, like I said, they experience something like that themselves.
Is that the same for you right now? Do you now see how important life is now? Before you were ill, and now is there's some sort of like difference in terms of, oh, I'm grateful I've lived
I'm grateful for every day that I wake up, because as I said, I could go to sleep tonight and not wake up. So yeah, I'm grateful for every morning that I wake up, and I'm grateful for the fights that my kids are having in the front room, as brothers. Yeah, I am grateful, but then part of me is still a little angry as well, because I feel that I've been let down and failed, like so many other people that have been misdiagnosed, or, their GPs or their consultants have not, listened, and then the news they get then is devastated.
It's angry.
Yeah,
it's
there
painful.
is part of anger there, because why do people not listen? Like I said, when you know your own body,
and this is the
effect.
It's not just an injury. This is a life, someone's life, and I wish, they listened earlier. And there's so many people that are in this position calling their GPs and, look, I don't feel okay. I don't feel okay. And they just give you like what? Pain relief and stuff like this.
Yeah, tablet after tablet after tablet. Just, we'll change your diabetic medication, or we'll this pain relief, or we'll swap that tablet for that tablet. It's not making a bit of difference. I'm still ill. I'm still struggling to eat. And when I did eat, then I couldn't keep it down. So constantly being sick. To go from a size 22, 24, which I was, a big girl, and now anywhere, depending on where you shop, because clothes sizes are terrible, but anywhere between an 8 and a 12 now, and to drop that amount of weight in such little time, that should be a concern to anybody anyway.
Yeah.
When you're losing that amount of weight so rapidly.
Yeah.
And it just went ignored.
And a lot of people are going through things like this. I mean, this is one example out of so many other people. So many people don't even know they're sick. So many people might not even know they have cancer.
Yeah.
And then when they find out, it's like really, really too late. What message do you have right now to people going through cancer and how they're surviving and how they're coping with it? Because this is a very inspirational
It
conversation
is.
for me.
It's very difficult. I mean, I've been on, so, you know, a lot of people moan about social media and the negatives, but there's also positives to social media. And there's a chemotherapy and cancer page, which I'm part of, where people can go on, and it's not just for the patient, it can be for their family members as well. So it's like a support network then, if you like, if people got questions. Because obviously people respond to treatment differently as well. And how it may affect me is not necessarily the way it would affect, you know, the lady sat next to me. But I think a lot of people struggle when they get a diagnosis of cancer, and straight away they think that that's a death sentence. Well, first of all, it's not. You know, there are people that get over it, you know, go through all the treatments and never get cancer again. And then there's, unfortunately, the other side of the coin where it's caught too late and there's nothing that anybody can do but talking, just talking, opening up. And it doesn't mean, some people may struggle talking to family. It could be a complete stranger. I've had a conversation with a young lady in Queen Street. I went to get a wig, because I was given a voucher for Lindra. And I sat there and had an hour and a half conversation and lunch with some young lady who I'd never met before, and her mum had died of cancer 2 years previously, and she'd never spoken to anybody about it. I ended up speaking to her dad on the phone. And it was almost like it was meant
to be.
I was meant to meet her and vice versa. And I still got her number now. And she texts me every now and again. And she said, you know, that's the first time I've ever spoken to anybody about my mum's cancer and how it affected me. So sometimes it can be a complete and utter stranger, but you need to talk. Everybody just needs to talk and be more open about it. You shouldn't feel that you've got to walk on eggshells. You know, cancer now affects you see, 1 out of 2 people now, and the statistics are just phenomenal. You need to talk.
Yeah.
Need to talk, and that's my message: is talk. Don't be afraid to speak to people.
Don't be afraid to speak to people, and that's why I made you call me in. And this is the first time I'm having a podcast conversation with someone that I've not had any relationship with, sort of. But if you can remember, since December, I've been chasing and I've always wanted to have you on the podcast because it is very deep and emotional and inspirational at the same time. Because what I want to achieve with this conversation is for people to understand that you can be happy regardless of what you're going through.
Yeah.
You know, if someone like you that know, I might go anytime, you're spending time with your family, making memories the best way you can. So why not you? Do you understand? Why don't you just give yourself the chance to be happy? Because obviously happiness will actually keep you more. You know what I mean?
And I think is just fighting every day. And that fight might just be getting up in the morning and putting a load of washing on. That fight might be just getting up and making yourself a cup of tea. Or it could be, you know, a shopping trip.
Yeah.
You know, everybody's fight is different, but don't let it win. Or if it's going to win, don't let it win easily.
Yeah.
Because I've given cancer one hell of a fight. You know, the treatments have not been pleasant. They're grueling. As I said, 45 rounds of radiotherapy I've had in total. I've had 35 to the chest and 10 to the brain. In addition then to 6 rounds of chemotherapy. And then I had to start another lot of chemotherapy alongside immunotherapy. But unfortunately that didn't work. So we had to swap the treatment over to what's called the Red Devil chemotherapy, and it lives by its name. You know, it's a red solution goes in you, it turns your tears red, it turns your urine red, and it's grueling. So I will fight with everything I got in me because it's not going to win easy.
Yeah, that's amazing.
And I still believe miracles still can happen.
Yeah.
Miracles do happen. Might not happen for me, but it might happen for the next person. But I also believe in alternative therapies as well. You know, I have plants in my bedroom that are supposed to promote sleep, so I've got those everywhere. Looked at my diet, looked at, you know, CBD oils and things like that. And I just think if there's something out there that may help or could help, why are you not going to at least try?
Try, yeah.
At least try. And I've tried everything. But unfortunately, the cancer is, you know, it's progressed and it's progressed quite significantly.
Yeah. And you know, the thing with conversations like this and with the digital content like this is this is going to be there forever. And if you'd want to use this opportunity to, you know, say something nice to your family, to your husband, or to anyone that's going to see this, I mean,
it's just, I mean, I wear my heart on my sleeve, so my children know how much I love them. I tell them every day, I have done since the day that they were born. I don't believe in this, oh, you can't kiss your children and things like, they're my children. And I would still kiss my children if they were 40, 50 years of age. Yeah. They're my children. My husband, you know, he means the world to me. He knows that. Everybody knows that. I mean, I still get butterflies in my stomach when I know we're going out for the evening together. And I don't think there's a lot of people that can say that. You know, we've been together 27 years, only married for 7, but together for 27 years. Both of my children, obviously, are my husband's. And I think that is an achievement because there's not many people this day and age, my age, that are still together and there's still one secure family unit. You normally find there's, you know, a stepfather or a stepmother or they're split between, you know, and they go and see their dads on weekends and so on. So I think we're very, very lucky to still be that one family unit. And yeah, my children know they can talk to me about absolutely anything.
Yeah.
Yeah, they come and talk to me about anything.
Thank you so much, Jolene.
That's my pleasure.
Thank you so much. I mean, this is one of the deepest conversations I've had this year. I mean, for a very long time. And it really, really means a lot to me. And I just want to say thank you so much for being right here on the podcast. Just like you said, I'm just going to hold on to it. Be happy, whatever you do. And of course, miracles do happen. You never know. And
no, you never know.
Yeah, I'm just going to hold on to that as well. Thank you so much for being on the podcast.
My pleasure.
I really appreciate it. This is Dr. RK. It's been amazing having this conversation. Do not forget you can subscribe to our YouTube channel. We have more episodes coming your way. Jolene, this was very, very amazing, and I'm so grateful for it. And I hope that you know, enjoy every bit of the moment you share. And then I hope to meet your husband and your children pretty soon as well, if I get the chance. And thank you so much.
That's my absolute pleasure.
Thank you so much.
Thanks for having me.
All right. Cheers. All right. Thank you.